back to school!
Whoa!
Oh man, so itchy! Ah, it's so itchy!
Every day, federal scientists are looking for new ways to kill bugs.
The only good bug is a dead bug.
Look at all that swag!
Metafluthrin. Indications: mosquito repellent to prevent mosquito bites. Fan that you may clip onto pants or place on a table next to you. There is no on-skin application. Each unit lasts up to 12 hours per day. Metafluthrin comes in a 31.2% concentration. Adverse effects include irritation to eyes and skin, so wash hands after handling. If inhaled, may cause various effects such as headache, dizziness, coughing and wheezing, and rhinitis.
DEET, N,N-diethylmetatoluamide. Indications: a repellent, when applied to skin or clothing, releases vapors that tend to discourage the approach of insects. Contraindications: do not apply over cuts, wounds, or irritated skin. Use of site: topical. Age limits: limited to people older than 2 months of age. Dosage amount: applied as needed to skin or clothing according to package directions, which usually is no more frequently than every 4 to 8 hours. Products of DEET: concentrations ranging from 10% to 40% provide adequate effect and significant protection for adults in routine situations. Products containing 50 to 100% DEET generally are promoted for adults with high exposure of insects for long periods, and when high heat and humidity may decrease adherence of the product. Higher concentrations of DEET may be associated with higher incidence of skin irritation. A unique polymer formulation of 25% or 33% DEET is available. It is also promoted as an extended duration product offering 8 hours to 12 hours of protection. For pregnancy and lactation, the products are considered safe if used properly, even in women who are pregnant and or breastfeeding. For children, children as young as 2 months can use DEET-based products in concentrations up to 30%. Elderly population, refer to adult dosing. Adverse effects: central nervous system reactions including seizures, hypotension, and angioedema have been reported in association with improper use or ingestion. Dermatologic: skin irritation is the most frequent DEET-related problem, with occlusion of the application area possibly contributing to skin rashes or eruptions.
The indications for this drug are temporary relief of pain associated with pruritic dermatitis, pruritus, minor burns, bee stings, and insect bites. It can also be used for mouth and gum irritations like toothaches, minor sore throat pain, canker sores, dentures, sunburn, hemorrhoids, and anesthetic lubricant for passage of catheters and endoscopic tubes. The contraindications for benzocaine are hypersensitivity to benzocaine, other ester-type local anesthetics, or any component of the formulation, and secondary bacterial infection of the area. Benzocaine is also contraindicated for ophthalmic use. The use site is generally topical, and the dosing is 5% to 20%. Instructions include: apply to affected area 3 to 4 times a day as needed. In case of bee stings, you should remove the stinger before treatment.
Age limits: pediatric. Due to the heightened risk of methemoglobinemia,
Not recommended for use in patients younger than 12 years old unless under the advice and supervision by a healthcare professional. Pregnancy. Reproduction studies have not been conducted. Lactation. Excretion in breast milk, unknown. Use with caution. Kids. Not recommended for use in patients younger than 2 years old. Elderly population. Refer to adult dosing.
Adverse effects of benzocaine include hematologic, methemoglobinemia, local, burning, contact dermatitis, edema, erythema, pruritus, rash, stinging, tenderness, and urticaria. A miscellaneous adverse effect also includes hypersensitivity.
Allergic reactions include local anesthetic, hypersensitivity, and allergy.
Would you like to know more?
Pramoxine is a self-medication for the temporary relief of pain and itching associated with minor lip or skin irritations, such as dermatosis, insect bites, minor burns or sunburns, minor cuts or scrapes, cold sores, rashes due to poison ivy, poison oak, or poison sumac. You should only use it for external use only. You should avoid contact with the eyes or nose. Do not use on the genital area or for rectal itching. You may apply pramoxine as needed 3 to 4 times daily. Pramoxine should not be used in children under the age of 2, where a pediatrician should be consulted. Lactating and pregnant women should see their clinician before beginning therapy. Adverse effects associated with pramoxine could be local burning or stinging sensations around the area where the ointment was applied. If this happens, quit using it immediately.
Would you like to know more?
Diphenhydramine hydrochloride. Indication: relief of pain and itching associated with insect bites, minor cuts, burns, or rashes. Contraindication are hypersensitivity to diphenhydramine or any component of the formulation, neonates or premature infants, breastfeeding. Use site is topical. The age limits are topical products are not for OTC use in children less than 2 years of age. Dosage amount: apply 1% or 2% to affected area up to 3 to 4 times a day for adults. For children greater than 2 years old.
Pregnancy, lactation, kids, elderly populations. The pregnancy. When administered orally, diphenhydramine crosses the placenta. Diphenhydramine can also be measured in the serum following topical administration to large area of the body. Lactation. When administered orally, diphenhydramine can be detected in the breast milk. Diphenhydramine can also be measured in the serum following topical administration to large areas of the body. Kids. Not recommended for use in patients lower than 2 years old. Elderly populations. Refer to adult dosing. Adverse effects. Frequency is not defined. Dermatologic. Photosensitivity, rash, urticaria.
Would you like to know more?
Lidocaine. Indications: pruritus, pruritic eczemas, abrasions, minor burns, insect bites, pain, soreness, and discomfort due to pruritus ani, pruritus vulva, hemorrhoids, anal fissures, and similar conditions of the skin and mucous membranes. Contraindications: traumatized mucosa, secondary bacterial infection of the area of the proposed application, known hypersensitivity to any of the components, known hypersensitivity to local anesthetics of the amide type, use site topical, dosing cream 3%, apply thin film to the affected area 2 or 3 times daily.
Pregnancy, lactation, kids, or elderly populations Children. Dosing in children should be reduced commensurate with age, body, weight, and physical condition. The maximum dose may be determined by the application of one of the standard pediatric drug formulas. For example, Clark's rule. Adverse effects do not apply to irritated skin or if excessive irritation develops. If condition worsens or if symptom persists unaltered for greater than 7 days or clear up and occur again within only a few days, discontinue use of this product and consult a doctor. Allergic reactions, local anesthetic hypersensitivity or allergy.
Here, hold on. Let's use this for that bunny.
So I need everybody flailing across the screen. So 1, 2, 3, flail across.